Hello, everyone. Welcome to today's episode of the Glow podcast. We have a very exciting guest here with us today. For those of you just joining the podcast, we are tailored marketing and specialize in helping dermatologists, skincare clinics, and aesthetic clinics grow their revenue and scale their business. So if you want to learn how to take your practice to the next level, make sure to stick around. And if you're interested in a free growth consultation, just drop the word growth in the comments. And so today we are here with Dr. Yune, and I'm just going to go ahead and ask you to introduce yourself so my audience knows who you are.
Yeah, thanks for having me, Taylor. That's really nice of you to invite me. My name is Marc Yune, and I own Aesthetic Specialty Center. It's a plastic surgery, dermatology, and wellness clinic since 1998. So I'm in Atlanta, a suburb, Roswell, and then I have another office at Lake Oconee, Greensboro, Georgia.
Okay. Awesome. Yeah, that's so funny. We talked about this, but I'm actually from kind of the Atlanta area and I'm traveling around right now, but it's funny, small world for sure.
Yeah.
So thanks so much for introducing yourself. And I just kind of wanted to ask you to share a little bit more about the history and mission of your practice and kind of what brought you to this place in your career.
Well, it's a long one because I started this almost 30 plus years ago. But I started the practice in Atlanta. I moved from Indiana and then did a fellowship in facial plastic surgery. Stayed on for another year with my mentor, and I was really able to gather a lot of education, totaling nearly 1,500 facial cosmetic surgery cases. Then I continued my education in body cosmetic surgery through preceptorships and surgical workshops, and ended up getting triple board certified. So we have a pretty good background in training. But when I started my practice, I was able to make a niche because during your training you have to write a scientifically legit paper, and mine was fixing the overresected nose. It's called a DART procedure.
Okay.
So that kind of gave us a niche that people didn't really like doing. And then it grew from me adding an esthetician, adding a dermatologist, and now we've grown to about 40 staff and 12 extenders, other providers. I'm still the only physician.
Okay. Wow, that's very impressive. Then you guys have grown a lot over the 30 years that you've been open, which is also very impressive, just staying in the market even for that long as well. So obviously with over 40 team members, you all offer a lot of different things. So kind of what sets your clinic apart besides kind of the things that you just said with your specialty? What would you say really sets you apart for your patients and clients?
Yeah, thanks. Really, I think doing kind of niche surgeries. So I created two techniques that are reparative for previous bad outcomes. The DART procedure I just mentioned, which is rebuilding the overresected nose, and then the ICE procedure was published several years ago. That's repositioning the malpositioned breast implant without sutures. And we're working on a couple other studies, such as BAM-MD coming soon, which is being able to do breast augmentation under the muscle with almost no pain. So
Okay.
that is kind of my portion of the practice because I'm the surgeon, but we have 16 different non-surgical offerings, and that's what's really exciting because my extenders, when I say extenders, I mean nurse practitioners, PAs, nurses, and estheticians. They comprise a team of about 12, and they can do any type of laser device. And we have a lot of those. So I think what makes us unique is we have a really broad menu.
Yeah, no, that's amazing. And for people who don't know, could we kind of go back just real quick to the overreceptive nose? What is that exactly? If you can explain that kind of to us a little bit.
Well, thank you for letting me drill down on that because it's an important message to get out there. And so what I noticed during my fellowship was my director and I were really the only facial plastic surgeons in town back then, many years ago. Now there's quite a few, but that's the type of surgeon that's done training beyond residency.
Okay.
Residency is kind of what you finish up. Everybody does a residency and they get board certified. Plastic surgery has become such a broad field that it's really broken up into multiple subspecialties, such as facial cosmetic surgery versus reconstruction, or wound care, burn care, or pediatric craniofacial surgery. So I really feel like what sets us apart is making sure that, well, the fact that we were able to do additional training beyond just standard board certification. To get on too much of a pulpit here, but board certification is necessary, but it's the tip of the iceberg. So
yeah,
that's basically what sets us apart. I don't know if I was addressing your question because I was getting a little tangential there, but
No, you're totally fine. So, what could you explain a little bit more in detail what the overreceptive nose is and kind of like how that helps your patient with, different aesthetics or medical? What exactly is that?
yeah, thanks for redirecting me back to the question.
No, you're
The reason I
totally
was going
fine.
there is because during my fellowship, then I saw so many over-resected noses, meaning too much cartilage was removed. It might
Okay.
cause a breathing problem, and it definitely causes aesthetic issues. Patients aren't happy with their outcomes. And I saw, and most of us in the inner circle realize that rhinoplasty is probably the trickiest procedure we do. And then what I saw was an opportunity to help these people by figuring out how to revise a bad outcome. So what this procedure is it's really called structural grafting, which is nothing new. I didn't really make anything new. I just took some proven techniques and kind of redid it. I repurposed techniques where
Yeah.
I'm taking cartilage grafts from the septum or the ear, maybe even the rib, and then doing spreader grafts, which goes alongside the septum, thereby opening an airway by broadening it, also being able to take the tip and pushing it down. And then there's another graft called the columellar strut that goes at the base of the columella, and that gives you the ability to project your nose forward. So those are two techniques, the spreader grafts and the columellar strut, have been around for years. I just took the three and connected them. And then I made a tripod like so that you can take the nose and push it back down, or you can push it out. You can push it out so that you have total control of derotation and projection. So the
Okay.
over-resected nose is the nose that's too short, which unfortunately doesn't even just give you a bad aesthetic, it also gives you a compromised airway. So by putting those three grafts together and then securing it to your tip so we can reposition in a real predictable fashion, I was able to fix the negative aesthetic while simultaneously opening the airway. And that was kind of the first time that was described because previous reconstructions were basically taking cartilage or foreign bodies and putting it on top of an already weakened nose. But if the nose is weakened, you're going to further compromise the airway even more so. So that's not really an adequate reconstruction. So I'm really happy the DART procedure has taken off. It's being quoted and used around the world now, and that was kind of our baby.
Yeah.
Yeah, so I'm proud of it. It's a difficult one to teach, but once you get it figured out, it just hits home runs on these people who have lived years with a compromised airway and an aesthetic they didn't like. So it's really given
Yeah.
me a lot of joy and reward to be able to help those people out because, rhinoplasty is not well trained in residencies. You don't really see
Okay.
it, single digits. You got to get out there and do 100 or more to even get your feet wet. That's why I keep emphasizing the importance of additional training like fellowships.
Yeah, no, that's amazing. I feel like you said, I mean, that sounds like just a huge advancement for these people. Like you said, not only medically, but also aesthetically. And I'm sure it's just helping a lot of people who maybe have had surgeries where they're not happy with and that's kind of what you said too. It's basically helping someone who's already had surgery but then something kind of goes wrong. Is that correct?
Yeah, I mean, I think what happens, unfortunately, many times, there's no legislation requiring minimum training in cosmetic surgery,
Yeah.
right? There's none. So you can actually get through a residency, pass your boards, have never seen a rhinoplasty. You can go get hospital privileges because your piece of paper says you're board certified. So that's why I keep
Okay.
discussing this very important teaching point that there is a differentiator. It's education and experience. So we are all board certified. That's not, necessarily bragging rights. That just means you passed a test and you did some higher education. What you really need to figure out is your surgeon experienced and trained in what you're looking at? And you don't know until you ask. I
Yeah.
think you shouldn't just assume because unfortunately I saw too many opportunities for these revision rhinoplasties because you don't want to dabble in something so tricky. You can't do one rhinoplasty a year. You can't see one or two rhinoplasties and go out and do a good rhinoplasty even on a primary case. So the whole thing about plastic surgery and aesthetic medicine in general is I would really love for us to get control over minimal requirements of training. Then you wouldn't have to have repairs of botched jobs. You can
Yeah.
see them, you know. I don't like
Yeah.
seeing those
No,
in
that
patients. I mean, it hurts me when I see that because it's so common. It's so common.
Yeah. No, that makes sense. I think like you made such a great point. It's really about the patient, asking their doctor, like, hey, what is your experience level with this surgery? Or like, how many of these have you done? And doing further research and also really promoting that education piece for our practitioners as well. And I know at your practice, you offer, of course, plastic surgery and then also dermatology. And how do you, how did you make kind of the decision to offer those two pieces together, and how do they kind of complement each other with your patient care?
Well, that takes me way back to the origins of my practice, where as a facial cosmetic surgeon, I would oftentimes have dermatologists refer to me for excisions of skin cancers and that kind of thing on the face. And patients would request us, I think because we try to offer a little bit more of a cosmetic, aesthetic approach to a dermatology patient. I'm not a dermatologist. I offer dermatological type care, which is usually referred to me by dermatologists, like I said, with skin cancers or facial scars or that kind of thing. But
Okay.
it's become integrated in my practice because many of my patients, let's say a facelift patient is healing and they want to ask you about this mole, and it's easy enough to do a shave biopsy on it and help them out. So just trying to give them more of a holistic approach so the patient get what they want. And I also listen to my patients throughout the course of years. I've heard them complain about certain techniques like punch biopsy, which takes a chunk of skin out, which gives you a better diagnosis in a way, but it can leave a scar,
Yeah.
which the dermatology patient with cosmetic caution. So we have kind of a really limited derm scope in our practice right now. We really just focus on hair loss. We don't just go straight to a hair transplant. We have a lot of in-betweens, and then like a surgical dermatology type practice with skin cancer being the main thing. And then cystic acne. There's an amazing new laser out right now that nobody really knows about called Aviclear, and that's basically taking a cystic acne patient off of Accutane and almost curing it, taking it down to a real mild level. It's quite phenomenal. So that's going to get some traction. It's getting more and more popular.
That's awesome. Yeah, I heard about another laser kind of that's similar to the one that you were just mentioning that helps with acne, and like a patient doesn't have to take Accutane anymore, which is amazing. And from what I've heard too, they're not super painful lasers either. They're not like painless, but they're not painful. And so I think that that's like a huge innovation right now within the industry, really, because Accutane obviously, can have some negative side effects that maybe patients don't want to have. And the laser is kind of, you do it like, I think it's 4 times over the span of a few months.
You know it well. You know more than most physicians out there because this just got launched recently. So I'm impressed. Yeah. Well, nobody wants their kid on Accutane, and teenagers can handle this
Yeah.
treatment, so you're right, it's tolerable. It's
Yeah.
really good.
No.
Technology is really making things different on a daily basis in this industry.
Yeah, there's a lot of innovations coming out. Besides that innovation, I guess, are there any other things right now in the industry that you're like, oh my gosh, this is just gonna kind of change the pave for our patients that has come out recently?
There's a new a product that's used topically for aesthetic purposes, but it's been around in the industry for a while for non-healing wounds and oral maxillofacial surgery and plastic surgery. It's called PDGF. The trade name is Ariessence. It just got FDA approved last year for topical use to stimulate collagen growth when you're doing facial treatments. And
Okay.
we tend to be a pretty progressive clinic, so we use things off-label when we know that it's safe, and so we're using it to inject the scalp and grow hair very robustly, even better than your own platelet-rich plasma, which we use to harvest from your own vein, spin it down, get the PRP, or platelet-rich plasma, which is robust in growth factor. But when you're older and losing your hair, you don't have a lot of growth factor in your own blood. What they did with this recombinant DNA technology is they took blood from the blood bank, and this eliminates the risk for human contagions, and they grew it on a yeast culture, and it now shows that it has up to 300,000 times more efficacy than your own PRP. So when we're
Wow.
injecting the scalp, let's say the frontal hairline, after one treatment, we're seeing very visible regrowth. It's really exciting. So we're going to use
Wow.
it a little bit on that, as well as the skin resurfacing and rejuvenating techniques. That one's really exciting. I think it's going to get a lot of popularity. So
Yeah.
then there's always the tried and true devices, which I can go on and on again about. I mean, like I said, we have about 16 of them. So
Yeah.
you can cherry pick whatever you want to talk about. We always joke about if you have it, we probably can tend to it.
Yeah. I'm sure, yeah. If you all have like over 16 devices, I'm sure there's a bunch of different treatments that you all offer. What would you say like most people are coming to you for with the different devices that you have? What is like kind of the most common thing that you're seeing right now?
Yeah, aging is probably primary complaint, and
Yeah.
you can attack it with surgery, you can address it with non-surgical devices, and to not have all the options really kind of shortchanges the patient. And that's why I felt it was important to bring all these non-surgical options, because it makes the surgical patient's results even that much better. So the tried and
Yeah.
true patients are coming in for skin laxity, aging, for instance. We kind of all age the same way, but using energy-based devices such as alt therapy, which is ultrasound, and microneedling with radiofrequency, we use a device called Secret. These are ways to
Okay.
heat the skin to a safe temperature that gives it some contracture. In other words, it shrinks. I call it the shrink wrappers of the face. And they're subtle, and so they're safe. What's in the industry really called for less downtime, less pain. Well, that's a more gentle machine. So to get the same results we used to with, let's say, a blade of CO2, you have to do multiple treatments. But the patients got what they asked for, and it's actually favorable because it's safer. There's less downtime and less pain. You just have to do more treatments. So all therapy and Secret are our workhorses for rejuvenation, and then sun damage. We clean that up with chemical peels and facials, and then we apply BBL, which is broadband light therapy, to treat the brown and red spots that we get even with or without sun damage. We have a vascular laser called the Cutera XLV that treats hemangiomas. It can get rid of a bruise from a lip injection in a day. It's phenomenal. So it's really
Wow.
kind of a vascular laser that has many more indications, but there's 50, so I don't want to bore you with all the indications, but it's two lasers in one. It's a KTP and ND-YAG, so it gives you a broad spectrum of wavelengths that you can treat all different kinds of colors. Very powerful. Then we have cool sculpting, which is one of the most popular treatments. It's been around forever, but we have two at both locations because you can actually treat 4 areas at once. And the results are even better when cool sculpting first came out. So that's freezing the fat, right? Non-surgical
Yeah.
fat reduction. Then we have cool tone, its cousin, which is magnetic muscle stimulation. So you can apply this to your abdomen, your thighs, and your buttocks, and it'll give you the equivalent of a workout that you can't do just with your own human capability. It might give you the ability to do, it might give you the equivalent of doing 1,000 or 2,000 sit-ups.
Wow.
That's a really cool device. Not that popular because it requires repetition, but those who love it, love it. We have
Yeah.
this
What did you say that one was called?
cool tone, cool tone. It's
Okay.
also a product from Allergan, makers of
Okay.
sculpting.
Awesome.
Yeah, we have Synetics laser. That's a cold diode laser, which is totally painless. Sitting under there for 20, 30 minutes every few days really grows hair. It's another amazing device that is not that well known. It requires
Yeah.
repetition, but it really does work. And then we have Thermi. Thermi Smooth helps to tighten up fine lines, especially around the eyes and the brow. And its cousin Thermi Va, which is used for feminine rejuvenation. The women who get that absolutely love that. We can almost get rid of their stress urinary incontinence if it's mild with one treatment. It
Wow.
requires some maintenance, but it's a wonderful device because it's helping women function better. They can jump on a trampoline.
Yeah. That's amazing.
Our scope is pretty broad. I think I'm missing some. Skin pen is another form of doing needling without the heat. And then we have a wellness component too. So we're offering IV therapy, supplementation that is medically based, and we also offer weight loss through terzepatides and semaglutides. So we
Okay.
have multiple prongs in every direction that all kind of come
Yeah.
together. I always say my specialty is make people look good, but I want them to feel good too. So that's why we
Yeah.
do everything from facelifts to skin cancer to wellness.
Yeah. I feel like those two things go hand in hand too. Like if you do look good, you feel good. If there's like a day you wake up and you didn't get good sleep the night before, like maybe you didn't eat super healthy the night before, then you like wake up and you feel bad and you look so I feel like those two things just go so hand in hand. In order for you to feel good, you have to look good, and kind of vice versa too. So what right now, I know you mentioned cool sculpting is really, really popular. A lot of your anti-aging stuff is really, really popular. So what kind of steps do you take, because it sounds like you all have a ton of technology and are kind of continuing to grow? What steps do you take to do your research to kind of find like okay, this is the next thing we're going to introduce to our clinics and to our patients.
When I was a young surgeon, I would see some of my senior colleagues, and it's pretty easy to get sold to. I saw some of my
Yeah.
colleagues in other practice just buying every device, and then they end up in the closet collecting dust because they didn't work.
Yeah.
So my filtration to get a device in my clinic is that, number one, it has to be safe. Two, it has to be efficacious so that the patient gets good dollar value and give predictable results. And if you can do that, so we have, fortunately, I've been in the business long enough where the companies usually come to me with new technology. I've probably passed on over 90% of the technology that's been brought my way because I just didn't feel like it checked all those boxes. We have always a group of willing staff and friends and family that want to try these things, and if I feel it's safe, we'll test it on our friends and family, and then
Yeah.
that makes me confident that I can bring it in the clinic. A laser rep will try and sell you a laser every day in this business. You have to be a little bit able to filter through it.
Yeah.
Yeah.
No, I mean that makes sense for sure. Yeah, and I mean I feel like you said it perfectly. You know, the first thing that you always have to look at is like, is it safe, and like, is it actually giving us real results, you know, because you can kind of make claims with these different things, but sometimes you're like, well, we're not seeing real results from it. And it sounds like you've done a lot of research on the things that you are bringing into the clinic to make sure that it's giving your patients the best results and that it's always safe for them, for sure. So besides anti-aging too, what are some other common skin concerns that you see with your patients today? I know you mentioned acne. Is that like a bigger one too that you're seeing as well?
Well, we do see quite a bit of scarring. A lot of it's
Yeah.
secondary to cystic acne. And that's where microneedling and fractionated CO2 laser really comes into play. Resurfacing techniques, chemical peels, this kind of thing. We talked about the vascular lesions and sun damage that we can treat beyond just regular laxity, which is, jowling or eye hooding. Our practice is really heavily focused on the cosmetics, so we don't see a ton of like superficial acne. We don't do
Yeah.
antibiotics, and we do the cystic acne. My practice is probably 95% cosmetic. So that's why
Yeah.
most of the people come seek help or talking about aging face or reshaping the nose or doing something maybe like a breast aug or conservative liposuction. That's my niche right there.
Okay. Yeah, no, cool. That totally makes sense. And obviously, like you said too, with your practice primarily being cosmetic, what have you kind of seen? Like, obviously, social media is huge now. People are kind of like, they're basing their expectations kind of around social media. So, how have you seen social media and just the rise in technology kind of change people's expectations and requests?
Yeah, it's been kind of a wild ride because, back in my day, we didn't advertise. We used to always kind
Yeah.
of joke and laugh about people that advertise saying they need to advertise because in this business, your best advertisement is just your happy patient.
Yeah.
That's the way best practices are built organically from the ground up with direct referral. But if you don't have some presence out there, people don't know you exist because the competition's humongous now. There's 200
Yeah.
med spas that open in our country every week. That's a lot.
That is a lot. That's
And that's
more than one per state every week.
right. That's right. And that's why I'm telling you that there's a lot of stuff on social media that may not have that much good substance to it, is what I'm getting at. The reason
Yeah.
why cosmetic has gotten the floodgates open is because it's a cash-based business. You don't have to have any minimum requirement. You can actually go take a weekend course to learn how to inject and then go open up your own injectable clinic, which is happening. So
Yeah.
that's unfortunate, really. But social media has done some good things too. For instance, decades ago, the gold standard for facelifting was the deep plane facelift. And then marketing took over and the facelift devolved. It became mini facelifts and lunchtime facelifts and weekend facelifts and made it sound cutesy and a simple operation by doing less surgery because you can do it under local. Well, those patients typically don't end up happy because I see them 6 months later routinely over the years saying it fell or it didn't work or it actually pulled my ear down.
Yeah.
So some of my colleagues I'm barely on social media. This is kind of a unique experience for me right now, actually. But I love it when we can educate somebody. I love it. I'm all
Yeah.
about educating people. I don't really like to promote myself, but I want to promote education and safety. So
Yeah.
there are some surgeons that have brought back the deep plane facelift. So I'm actually having patients come in and say, I saw one of your colleagues talking about this, and that's what I want. I'm really happy to see that. The problem with deep plane facelifting is, again, we're going back to lack of training. If you don't have a number of cases under your belt where you know how to dodge around the facial nerve, then you don't want to do a deep plane facelift because you can give a patient a really bad outcome. You can injure their facial nerve, which would change their facial movement, weaken it, which would be a disaster.
Yeah.
That's why the majority of people doing facelifting aren't fellowship trained facial plastic surgeons. They're doing mini facelifts because they're taught this on a weekend course. So social media has helped the facelift. It's kind of hurt the non-surgical side because there's way too much, frankly, I mean, with all due respect, there's way too much garbage out there on social media that makes people makes it seem fun and simple. And I mean, everybody has their own taste, but I don't really want to see my provider dancing around, you know.
Yeah.
Showing me that they have good dance moves really doesn't impress me as a healthcare provider. I'd love to see our industry keep it a little more professional.
Yeah. No, I totally understand that. I feel like, yeah, you're right. Social media has been helpful for certain aspects too of the educational piece, but really on social media, like anyone can just say whatever they want to say. So they may not have the actual experience to be telling people about these things, but of course they're able to because it's social media and you can just really say whatever you want. They're not getting maybe as much backlash and people are listening to things that aren't correct.
Truly. I mean, I think what happens is because the competition has gotten so fierce, especially for these young startup companies, that they have to have a niche. Kind of like I carved myself a niche
Yeah.
by doing things like uniquely or trendy. There's some injectable techniques that are just completely ludicrous that are being bragged about on social media. Even my own injectors that I trained for over a year, they come to me and say, what do you think about this and that technique? And they're really not necessarily good at all.
Yeah.
Vertical lip filler has to be done very carefully because oftentimes it ends up in vertical ridges and nodules. That got really popular on social media. It's a mistake because I see these patients coming in and said, I had this technique I saw on social media, and so I went to my injector and they put these little, and now I got all these vertical lumps in my lip. So, well, that's not the way the lip was built. The lip is tapered and smooth and almost kind of like a tapered cylinder. So that's how we fill a lip, is in a horizontal pattern.
Yeah.
And so that one hopefully is going to die by the wayside. They call it the fencing or something like that. I don't know. I mean, maybe some people get a good result with it. I just see the bad outcomes from it.
Yeah, no, I believe that. That
The
is,
other one that got really popular on social media was filling the tear trough, which is helpful if the person has a hollow tear trough. But if they have shadowing from a bulging fat pad in the lower eyelid and you put a filler in that tear trough below it, you're actually making just a taller fat pad. So you have to be really careful using filler because you don't want to make somebody look like they had filler. You want them,
yeah.
anything we do, we want them to look natural. We don't want them to look like they had anything done. That's the happy patient. Even their friends and family can't detect it, you know.
Yeah. No, for sure. I agree with you 100%. Sometimes, I think also too, sometimes social media maybe sets like an unrealistic beauty standard, you know, if people are getting different surgeries done and things like that, people are expecting to go and get, you know, like lip filler and look like a completely different person. And like, that's not what it's for necessarily, unless that's what you maybe want. So how over kind of with things like social media and really just the industry as a whole, how do you see kind of the industry evolving over the next 5 years?
It's hard to predict. Just when I think I know what the future holds, things come a different way sometimes. So I'm hardly an expert on technology or social media. I'm just a simple surgeon. I don't know. We'll think about that question a little bit more in depth. I hope that we can stream it into a direction that's more educational for the patient instead of a sales tool, you know.
Yeah.
There's nothing shameful about selling something that you're good at, but instead of just making it gimmicky and fun and making it like a popularity contest, I love the content that my own staff put out, which is very educational. So I have a lot of providers and they like to do their own Instagrams and Facebooks and they put out some really solid stuff because they're teaching the patient, which then gives quality and a lot of credibility to social media. I think your best marketing or promotion is through education.
But so over obviously with your business too as well, what kind of the goals for you all for the next 6 months to a year or so?
Well, I am getting a little older, so we're really looking to help support what I'm doing, and I want to pass the torch to people who I really trust. So I've built this
Yeah.
practice over 30 years, and I'm really proud of our culture because we have a really great, tight-knit group. Everybody's very supportive of one another. It's a team, and we call ourselves the ASC fam because they really are like family. I've got one of my
Yeah.
staff right now housing my new PA and putting her in her private home because she's still looking for a place to live. That's pretty amazing. My nurse
Yeah,
brought me
that
in.
is amazing.
Yeah, so the culture, that's got to be kept moving forward. So I'm recruiting currently, well, I've got so far a young fellowship trained facial plastic surgeon who's going to be joining the practice after her maternity leave. And then we're looking for a general plastic, more of a body specialist to do things I don't do, and even cosmetic
Okay.
gynecology. Then we'll finish building out the OR in my Roswell office, and then I'll still be here as long as I can operate and as long as I'm still decent at it. I'm going to hang in there, but adding more surgeons is definitely the plan. And then we'll probably add to our dermatology and our wellness component as well, because I'd like to bring bioidentical hormones back in. So
Yeah.
that just, growing the practice slightly. I don't know if we're going to open up
Yeah.
another office. I'm getting too old for that, but just steady growth. Sure, and steady growth is our key.
Where are your two locations at right now? I know you have one in Roswell, and then where else is the other one at?
It's in Lake Oconee in a town called Greensboro. It's a rapidly growing retirement golf and lake community. So it's
Okay.
been found out. I went out there 26 years ago and just loved the place. It has amazing golf and it has one of the nicest lakes. It's not polluted. So I set up
Yeah.
shop there when there was probably not even 500 people living there.
Wow, that's wild.
We got a Ritz Carlton and we have 7 golf
Yeah.
courses. It's pretty
I
amazing.
was gonna say Lake Oconee is one of probably the nicest lakes in Georgia, honestly. I love Lake Oconee.
Yeah, it feels like home to me. I go back and forth every week, and everybody says to me, "You're crazy for doing all that driving." I said, "No, you don't understand. It's like a vacation every weekend." And then when I get
Yeah.
tired of that vacation, I come back to this vacation in Roswell. So I'm
Yeah.
very
No,
blessed
Roswell's
to.
awesome too.
Yeah, yeah.
Yeah,
And
well,
I think it's so
good.
important to have work-life balance, and that's what I think everybody should strive to do, not work yourself to death. Surgeons all end up with bad necks and backs. You got to keep some balance in life. It's okay to play around in golf once in a while.
Or go out on the boat on Lake
Yeah,
Oconee.
that's right. That's right.
Exactly. Well, cool. Well, let my audience know where they can find you on either social media, on your website. What's the best way to see kind of what you all do and what your practice does?
I'm embarrassed to tell you, I don't know what my social media names are,
That's
but
a
our website is www.asc, as in Aesthetic Specialty Center, right here on my shirt, I guess. ASC-PSD, like plastic surgery dermatology.com.
okay.
ASC-PSD.com. Yeah, we'd love to help anybody out. We really love what we do. And our phone number is 770-393-9000.
And I'll put all of that too in the show notes as well. So people will just be able to click on the website or anywhere else really where people can find you. And then thank you so much for coming on. I really, really appreciated our conversation and just learning about all the treatments that you all offer and also talking a little bit more about that education piece. And so thank you so much.
Thank you for having me. I really appreciate you.
Yeah, of course. Have a good one.
Okay, take care. Enjoy New Mexico.